right. Hello, everyone. Thank you for being here. We are so glad you're here. Athena and Corrina, in case anyone's like, who in the heck are these ladies?
Yeah.
So, we are trying a new microphone setup today. So, let us know if it sounds okay. And once we have a couple questions in here, we will be doing some Q&A, answering y'all's questions. And we also have the singing bowls here as well. So we could even start with a little singing bowl section if you'd like.
Yeah, is the mics working okay?
We don't know yet, but we're just gonna pretend like they're fine. I'm sure they're fine. I think that's more
That looks
straight.
straighter, yeah.
Actually, no, it's more crooked.
Oh,
Okay,
you
I need
think so?
to tip it this way.
I thought it looked.
Tip it.
Oh, maybe that's it.
I think it's something where the more you look at it, the more you can't quite tell.
Yeah, like
if
a
it's
picture.
straight, if it's straight or not. Exactly. So yeah, let's go ahead and do some bowls here.
Okay, let's just start out really calm.
And then I'm gonna leave my mic here, and then I'm just gonna run out and listen.
Okay. Okay. A nice relaxing start.
Hello and welcome. Thank you all for being here.
Yes.
So, Athena, do you want to talk a little bit about we have our newest addition to the Athena Jezik channel. His name is Skelly. And so Athena put quite a bit of research into finding a skeleton that articulates. You want to talk to them, explain what that means, what you were looking for, and why we really had to do a little bit of research to find the perfect skelly.
Yeah, so many of them are skeletons for the decorating of for Halloween and stuff. So they're not quite the ones that we want to use for medical stuff or showing things on the skeleton to learn anything about the joints and all that. But yeah, I needed one that would articulate and that would show the number of bones that we have, like there, yeah, in the hands. And nothing that's put together with plastic is going to articulate perfectly, but at least it articulates enough to be able to see, like this part is the palm of the hand, and then we have the finger, this from here, and then this little one and this little tiny one. And so all those articulate, and it kind of shows you where things are in the thumb. And then a lot of the wrist bones that are there that we can See, when wrists go out, there's just a matter of moving them in certain ways. That's what I'm teaching in this subtle anatomy course. Because if you understand where the bones are and how the joints lay together, then you'll be able to take these smaller, this more subtle part of the body and be able to align it properly. And then, of course, you have muscles and stuff that on top of it. So you can then get into the muscle if there's still tension there. However, if you don't really know where the bones are, sometimes they're hard to feel on certain people. And if you don't really know where they are or what you're feeling underneath it, there might be a misinterpretation as to what you think is there. But you have to land on those bones. If you're going to align them, you have to land on them. And sometimes you don't really know where to go. And most everybody just pops bones where they think they should go, but they don't understand the subtlety of the body moving those bones slowly back into position when there's a little bit of misalignment. And I've seen people come in and had like ankle pain for so long because they had a sprained ankle or something, or they had to wear a cast or a boot or something, and there was just a little misalignment. And it's not really cranial sacral work that I'm doing, but it's what I've added onto it to make it a little bit more efficient. Then I would go down to their foot and ankle and be able to, I don't know if he's that flexible, but we'll see. Let's see. He's kind of moving like I am these days, very stiff. Wait, this joint up here isn't. Oh, maybe this leg will be better.
So the articulation just refers to the joints moving the way that they move in a human. So finding the skeleton whose joints could articulate in a similar way was really important so that she can teach how to do the subtle alignment techniques where even though you're working on a person and you can't feel their bones through them usually, right? You need to kind of have an understanding of how the bones are placed and which joint you're trying to kind of be touching in on. So having a visualization of the skeleton is super helpful. And that's kind of our whole hope with the skeleton, is it really helps teach the techniques in a greater level of detail.
Yeah, and I think it is just really important, because actually when you are working subtle anatomy in the limbs, you're going to find that a lot of times you can't get really to the bone, but if you know where it is and where the joints are supposed to be, then you can go in energetically and you can affect that energetically. I'm getting more people that are interested in doing Reiki or Reiki practitioners who are wanting to learn the subtle anatomy part, because there's a couple people that have gone through with that and they say that it just enhances their work. There's another piece to that I can get to in a little while about the subtleties and the energetics of knowing. I mean, it gets pretty subtle. It gets into the energy body as well, but we'll cover that later. So these bones of the foot. So there's the top of the foot bone, kind of. I'm just going to be very lay person in this. And then you have the actual joint of the ankle, which basically moves up and down, but it does have a little side motion. It doesn't really show a lot of side motion because it actually comes more from the foot. So you can get down there and you can find these things, and sometimes they're hurting, and I'm often times on the top of the foot because that's where a lot of the misalignment is. And then you just find around, and your fingers will just find these spots that don't feel right, and then you just hold it with 5 grams of pressure, and you just wait. You just wait on it. Sometimes you're going to have to take your other hand and maybe put it behind to anchor a bone while the other one is moving. But it's really quite incredible when you begin to understand the positioning of the bones along with the other. His toenail caught this. Without the, can you see to get that
undone? Oh my gosh, talk about subtle alignment.
Yeah, he's catching it all, isn't he? Sorry about that. So yeah, it's really an important thing to get that to be known. His hip isn't really, there we go. He articulates, but he's not, because of all the hardware, like my hardware, he's not as articulate as the human body will be. And you can tell when there's swelling around those bones and everything else, which is why it's kind of good to know the technique of moving fluid out of the area as well. But I'll back up a little bit and let you know that some of the subtle stuff is really amazing. And it's really important to have ourselves aligned, because I was reading yesterday in the vibrational medicine that the chakra system and even the meridian system, they somehow, especially the chakra system, ties into the central nervous system. Of course, the central nervous system now, the cranial system, that is the central nervous system by and large, because you're dealing with that the spinal cord and the spinal column to a degree, and all the little, nerves that go off that. But then
we have this right here.
yeah, thank you. So it deals with all of that, and the chakras. Now, of course, that's coming through the front of the body. There are back chakras too, but basically we work the front of the body, and those chakras are energy circles, and they are above a nerve plexuses on the body, as well as different glands. Now, the subtlety of that is when they're aligned and there's a certain frequency that they are beginning to have, then what will happen then is that the hormones will be activated, and this energy would be activated. And it's actually, unless I'm reading this wrong, but it's actually that when you get to that certain vibration, the vibration itself through those energy bodies, the nadas is what carries it there, through the chakras, is that the vibration will actually produce hormones. Now, that caught my eye. I didn't read it a bunch of times. I didn't go to other areas and look, because that kind of thing is hard to find. But if that's possible, I can see where that could be possible, and that's why the alignment of the body and the the function of the alignment and keeping things straight so energy can flow well through the body. I think that's why it's so important. So to tie that into the cranial system, then you're getting that main alignment happening through the spinal cord, where everything, you think of the chakras, it's going right through that area. And then you can work, getting the head placement, so you get the fulcrum of the body, which is, up here. This is the atlas, and then the fulcrum is inside of there, like straight back. If you take your finger in your mouth past the epiglottis, then you'll find that fulcrum, and I've showed it many times before. So that will be aligned, and then the energy can start to flow differently in the body, because those are little avenues of energy in the body, and there's different names for it. There's each different culture that operates in that kind of a mindset for medicine. That's one of the things that they'll tell you, is that this is like the life force, and this is the life force area. But when you start taking it apart and looking at it with the anatomy and all of that, it begins to appear as a whole different picture. So I think that's really important. And is that the
So yeah,
okay, that's that
when
one that
she
doesn't.
talks about the fulcrum of the body, can you explain what you mean by that? And why is this little spot so important?
Yeah, it's where the purple and the yellow come together. Okay, the spine comes right here. Okay, so if you're standing like this is superior and anterior to the spine itself. So when you just get a back adjustment, you're just getting the spine done, but you're not necessarily correcting anything that's going on here. And this is the fulcrum of the body, and it's just it's a joint. It moves, it feels like it moves a lot, but it's not a lot of articulation. And it's in this little saddle here where there's a little dip. I don't know how well you can see that.
Yeah, they should be able to see that real well.
But that's where the pituitary sits, and then the pineal is a little bit behind there. But that right there, when that's in alignment, that's when your spine will be in alignment. And so if you get that alignment, and then you go to have a little bit more of an adjustment where they're pushing a little harder, it's going to be easier. Although I myself don't like quick, hard things, because it traumatizes my body too much. And this also, this is the occiput, the base of the occiput, and the sphenoid bone, the spheno-basilar junction. And it really does, it touches nearly every bone, except for the frontal bone isn't overly involved, but you do have a little bit of it touching into
So
the.
show them a little bit more. Yeah,
Okay,
there we go. Now I got it good.
okay, like me to look underneath. Yeah, the frontal bone, the blue bone, doesn't really. Uh, Wait a minute, it does touch the sphenoid bone. I'm sorry, I got a little mixed up there. The frontal bone does touch the sphenoid bone. The temporal bones touch. This little green that doesn't touch as much, that's the parietal bones, that touches. And then the back of the head, the occiput, also touches. So all of that. So when this the sphenoid bone is off kilter, all these other bones are going to move off kilter because that's just the way that it is going to go. That tilts to the side or rotates or anything, the rest of the bones are going to twist with it. And that's what the 5-gram cranial sacral work is going to do. It's going to align that back up. And then you can have other things. In fact, even if you can, you probably can't see this, but even if you can look in the eyeball, it goes into the orbit. There's little pieces of the sphenoid bone into the orbit itself, along with a couple other nasal bones. So it's pretty intricate. And then when you start thinking about the movement of the energy up and down, that's a whole nother concept. And I think these concepts are really important to grasp because there's so many people, and I don't mean anything, I know it's all a matter of growth and what people can comprehend, but it just amazes me at how few people that have been in the alternative or the medical world that take it this deep. I think the medical world has got us so conditioned that there's only one way to do medicine, that I think it's very hard to break through that and get people to look deeper into the body and more of tissue wise, energy wise, interstitially. When we're doing detoxifications, we have to actually get the interstitial fluid cleaned out, and that's around every cell in the body. So there's so much more to it, and that's going to take a while to really catch on. But for those who can understand what I'm saying and they have a desire to, take some courses in this, they can take many other courses if they want to, but just get the kind of the baseline of what really is going on and what is really important to begin to get ourselves back on the path of good health. Because diet and all that stuff is important. All of that stuff that we've heard about is important, but it's not going deep enough. It's not going into the depths of the subtleties of what we're made of and how miraculously we're really put together. I mean, it's incredible.
So
So,
Cecilia has a question here, and
uh-huh.
pardon me if I'm not saying your name correctly, but I'm thinking this is Cecilia. Um, Says, what are good techniques to help support this area? So that was when you were talking about the spheno-basilar
Oh,
junction.
yeah. Well, the spheno-basilar junction in that area, it once it's out, it's basically out. Um, it has to go back in with it's called, there's a resistance. Like it will continue to do its flexion extension. I just use a bowl. It just does its flexion extension, but if it's tilted a little, then it'll do the flexion extension like this. Eventually, you'll normalize to that, but then you'll also get out of alignment in other areas and you'll feel your little aches and pains here and there, but it's never anything really emergency like. So the only way to really fix this or deal with it is that I know of, that's not forceful, is to have that 5 grams of pressure sitting on the wings of the sphenoid bone, which is that yellow area. This is a really old skull, and he's just been through the mill. But there's little yellow spots coming out of the side here. I got to keep watching. So that's where you do that, and then you have to anchor your fingers on the occiput, which is you want to do it up higher, like above where the spine is. So you're holding it kind of like, it's kind of hard to do when he's just in thin air. So your bones have to, your fingers need to be placed somewhat like this. And then you feel for the flexion extension in the sphenoid bone, and you need to anchor this bone. Otherwise, these two bones just keep moving together. So if it's crooked on this bone and this bone, I hope this is an illustration. If this bone is off, then this bone will be off. And so then it's just going to flexion and extend in that off position. So you want to anchor the occiput, which is the bottom bowl. You want to anchor that, and then as this one doesn't have anything to follow, then what it'll eventually do is it'll move around in ways, and eventually you'll feel it. It feels like bubbling or pulsing, and then eventually it'll move back into the position that it is. Sometimes as it moves back into that position, it's been so tied up all the way, down the spine, that people will release and their foot will actually fly up in the air a little bit or jerk or something. And that's just releasing that whole tension that's going all the way down the body. And usually when that happens, when you get good at what you're feeling with the cranial work, you can always feel something happening also with the sphenoid bone. As that jerk, something else happened. So then the sphenoid bone can go back to that position. But that's really about the only way that I know that would be able to, I suppose there's, things people can do to push it back in. But I think that just considering what that bone is all about, I would consider that to be a little bit too traumatic on the body. I know I wouldn't want that to happen to me with that kind of force. So that's something that you have to kind of just tell yourself, do you want the force? It may make you feel crazy for a while because it's so fast, but I don't think it's going to be able to hold very well either, because it happens so quickly that it'll slip right back to the old pattern because there's no neural pathway that's telling it to be in a different position. So it's kind of never really kind of connects with the body until you do it a bunch of times. And you don't have to do it that many times. If 2, 3, it moves fast, especially when you have a therapist that's not putting too much pressure on it. So yeah, that's kind of that in a nutshell, or in a big nutshell.
So kind of the big picture is that it's craniosacral therapy that are these different techniques she's showing on, like holding the skull and all the different cranial bones, which is what the skull is showing you, allowing all those different cranial bones to just ever so slightly shift their position. And so kind of the idea with Athena's technique and using this subtle work, and she keeps talking about the 5 grams of pressure, the idea, rather than moving the bones into a position like, with a lot of pressure, you're just gently holding the bones. And what she's kind of saying, like sometimes you need to anchor on one of the cranial bones to allow one of the other ones to shift. But you just use this super gentle pressure, and then the body actually starts to align itself. And that's where it starts forming those new neural pathways to that new alignment or that new position, so that you can actually keep those changes after you get this work. So cranial sacral is kind of the positions on the skull and on the sacrum right here. And then subtle alignment technique is kind of what Athena has created after doing craniosacral therapy for a couple of decades.
38 years.
She kind of realized, you can take this same kind of concept of letting the bones align and find their ideal alignment and use it on the entire body.
Yeah.
So cranial sacral therapy really just addresses like this area, the spine and the sacrum, and then subtle alignment is from the very bottom of your foot to the very top of your head. You go, and then in her subtle alignment course that's available, we have the link in all the videos. We actually go from the foot all the way up to the top of the head, showing all these little joints and these different kind of common areas of the body that present as sciatica, low back pain, headaches, upper back pain, all these different issues that can kind of all end up being traced back to these little tiny misalignments that get created from our posture, from our repetitive motions, from all those different things that we do in our lives that can kind of contribute to us coming out of our ideal alignment of not only the joints of the skeleton, but then those even more subtle layers. And so Athena does lymphatic massage. She's incorporating kind of all these different elements to try and help the body find its ideal alignment. Is that
Yeah,
kind of
that's
a...
pretty much, yeah, the lymphatic, it's actually lymphatic drainage because there's a accumulation of water in places. And that also has the lymph system has other roles to play, but it's good to keep that flowing because the immunity is stronger when the lymph system isn't kind of gelatinous or cottage cheesy. It will definitely, have other things happen. So we kind of fall back into that. We have to be careful what we eat. I mean, it all encompasses this whole thing. But the thing also too is that when that spheno-basilar junction is out of alignment up there, hidden inside the head, the dural tube is going to, twist and turn a little bit. And so you get down here, and the sacrum actually has to accommodate where that is, and even a little bit of the coccyx. But basically, the sphenoid is going to have to, you know, go with the opposite direction of the head, because it's like when you have children's blocks and you're going to stack blocks, and let's say you get 4 or 5 blocks stacked, and then one of them is just a little bit to the side, you can go up a little ways, but then you have to push the other one over to the side so that you can keep the balance. So that's what's happening all the way down, and that's also why it'll go down into the foot, and the even the cuboid bone will be misaligned, and the knees can be a little bit off and all of that. So that's why it's good to check all these little bones, these little joints that are usually just kind of forgotten about. And it's not a huge thing that happens, but it's enough to wear and tear, and it's enough to, just cause different things going on in the body that we still don't know. I mean,
So here's the sphenoid bone, this really cool looking bone. And so do you want to grab that skull there? We can.
Which one?
Yeah, that inside, because then you can see. So this is the yellow bone there, and then this is what it looks like.
This part is the legs, and that goes in the mouth.
So
it would be like this.
When you're touching your temples, you're just barely able to engage with the little edges of this bone. And this is why you never want to have a lot of pressure on the temples, because this is such a delicate little bone and what Athena considers the fulcrum of the body. So this bone, because of the way it interacts with all the other cranial bones and with the spine, affects the flow of the craniosacral fluid through your spine.
Yeah. Now, so people that have gotten hit really hard on the side of the head, like with a hockey puck or baseball or something, if you can imagine how that will be shearing over to on horizontal, it'll be shearing horizontally. And so all of these bones are actually slid off into a shear, because this will be off of the base enough to, so it'll still flex and extend, but it's going to feel different because it's not centered on the base. So you have to just work that back, and you do that with certain techniques too. This is where craniosacral therapy is an important one, and I encourage people to, take the course of craniosacral and then add things to it, or because this enhances a person's work. I don't care what modality they're in; it really does bring a different kind of perspective to the whole thing, and it brings different results as well. So I guess that's about
it.
And
then Stewie, thank you for being here. Thank you for moderating. Stewie asks, how did you learn all this stuff in the first place?
Well,
just backing it up a little bit.
Back up like 30 some years, about 35, 38 years, something like that. I just had a lot of practice. I was in the practice, and I did massage therapy for a while, but I found that too many people were coming and massage didn't address anything. So back in those days, in the earlier 90s, they would send little cards out to different people. You didn't have the internet or anything. So I got this card in the mail, and I thought, this sounds really crazy. But for some reason, I thought, it's in Houston, I'm in Austin, I can just get a room for the night and see. And I was so skeptical when I went in there. But then after the very last day, it was a 4-day seminar, they threw so much stuff at us, and the head and all this other stuff.
And it was craniosacral therapy.
Just Yeah.
Because I don't know if you mentioned
Yeah.
that, but this was a cranial sacral therapy. So
This
how
was
long
level
had you
1.
been doing massage when you got the little card?
I started doing massage, let's see, it would be about 5 years that I did
Okay.
massage. Yeah, and I was very intent there on getting muscles to the origins and insertions, and that's where a lot of the older videos are focusing on that, because I was considered, at the place I was living at the time, I wasn't very favored by other massage people because I had more clients, which is like no big deal, but it's like people are jealous and all that. So, but when I brought cranial sacral into the platform, um, I mean, I got threatened by doctors and by physical therapists and by chiropractors, and it was a really hard road to hoe because it was just so odd. But yet doctors would kind of throw away patients over to me when they couldn't do anything else for their neck and they couldn't turn, just stay on your pain meds and you know hope for the best. And or headache. One lady had headaches so bad that she was a pain medded out to the end of the rope, and so that doctor threw her over to me. And the first time that I worked on the neck person, she went home and her husband called and he said, "I'm so furious with that doctor." He said, "She went off of her pain meds tonight and her head rotates perfectly." And so that was good. And then the other lady, she got off her meds, and probably where they didn't like me. And she was playing with her grandchildren and functioning, because she was pretty dysfunctional when I got her. And those two did come about. The neck person came about maybe 6 or 7 times, and then she just felt good. And then the other lady, she was there about 2 months, maybe 3, until she was really functional. And then, of course, they went back to their doctors to get another exam. And the doctor, who couldn't do surgery then, he said, "Oh my gosh, we have to do surgery right now or you're going to just hurt yourself." And it's like, what are you doing? And then the other lady, she said, "My doctor said I have to get back on the medicine or I'll never be playing with my grandchildren." And I said, "You're playing with your grandchildren. What are you talking about?" But they didn't get it. Back in the 90s, they didn't get it. It was so far from their sphere of understanding that they couldn't even take the experience of getting better, because they trusted and believed so much in their physicians. And so I think today's day, we're all a little bit more cautious about what they're telling us. And a lot of people are seeking out other avenues to also help. But you also want to be careful of that, because whenever something is changing position, there's always a lot out there that don't really know it. So you have to ask questions, I would say, and somebody that you resonate with, somebody that you feel like you can trust. That's the important thing. And as far as me learning it, I just practiced.
And then talk about the cranial sacral little card that she got and ended up going and doing
Oh
this
yeah, I did.
seminar. That is the Upledger Institute.
Yeah.
And you actually worked with John Upledger.
Yeah, I did.
In person. So the founder of cranial sacral therapy was actually able to work with Athena, and that's where she was learning these cranial sacral therapy techniques.
Yeah, it was with a small class of people, so it was in an advanced course. But John always, I sat and talked to John once, and I said, "John, I just can't get all those bones, all those names, all that stuff. I just want to get my hands on people and help them." And he pulls me aside a little bit and kind of leans. We were at lunch and there were other people at the table, and he says, "Just get it in your hands. I have to do it this other way because that way I can give CEUs out." But he said, "Just get it in your hands and the rest will come." And that's true. Get it in your hands, and then you'll start learning the bones. You'll start feeling things. You'll start knowing where to go from there. That is an individual class. If somebody wants to get a little bit of cranial work, I can show you how. But primarily, I help a lot of people that have been through the course and they're just not confident enough to, to really bring clients in. So I help them with pressure and hand placement, and just get them on the road to it. They know most of what they need to do, but they're just not sure what they're doing. Everything's weird when you start out with something different.
And then, so if you look on our last couple videos that we posted on the channel, a couple of them are from this apprentice course where she's actually working hands-on with two different students, teaching them these different craniosacral therapy techniques
Actually refining them.
and refining them.
Yeah.
And so those are really interesting videos. If this is the type of body
Yeah.
work you're interested in learning, you can visit Upledger Institute. That is where you can get training in craniosacral therapy. And then Athena also has a course that she created on subtle alignment. And so that is the kind of from the bottom of the foot to the very top of the head, the full body protocol of the work that she's doing. She's now teaching that to y'all. And so that course is available if there's people out there that really want to learn how to do these techniques.
Yeah, that's a good one to mix with massage, because a lot of massage therapy will have injuries coming in, and instead of just working the muscle, you actually get down to the bone, to the joints, and then allow that to move itself into a different position, and then gently work the muscle into a deep thing. But just going into an injury, deep pressure, that's really, I mean, it doesn't even make sense to me, because it's like, why would you want to put more injury onto an injury by just traumatizing it, by just forcing yourself in? So that's where I want people to distinguish it. But this would be excellent for, for massage people, really, from the bottom line, because you would be much more effective at your work. But also, it's good for any other modality. Reiki is the person that I know the best that did the Reiki thing. I mean, her Reiki practice has just gone through the roof, and it's because she can touch the body now, and she can actually feel the energy of what's happening to the tissues, unwind them a little bit, and then she feels like all of the other work that she does off the body is just that much more intense. So I mean, it's up to you, but that's the kind of what I've been observing. But it's taken me a long time to get this far, and I just don't do very much of it anymore. Certain circumstances have gotten me in a little bit different position. So, but I certainly did enjoy when I had a lot of clients and I watched a lot of people be helped a lot. It also will help, not so much that, but if you get the cranial part, you can help with all kinds of things, children that are traumatized and all kinds of things. So it just depends on what direction you want to go with it.
All right, so we have another question here.
I hope I answered that okay.
Yeah, no, I think that we're doing good. We have a lot of people saying thank you for the explanation. So
I think they're
enjoying it.
Because sometimes I just go off, and there's so much to it. I just go off here and off there.
But. So Rover, thank you for your question, Rover. Hello, lovely ladies. I was wondering, what is the best solution for scoliosis? Thank you from one of your loyal followers. And I pulled Skelly over because I don't know if you want to talk about the spine.
Scoliosis is where the spine is curved, and there's sort of different types of scoliosis. Some of it comes with posture, and that is easier to correct. Some of it, if people are born with a very serious scoliosis, there's really not a whole lot that can be done other than maybe giving some relief to some discomfort. And that's because the bones are in a different kind of a shape. Now, there's another strange phenomena that has been discovered since I was in Cranial, actually in the institute, and that is that a long time ago, you might have known that they use these metal braces, and it locked down a suture, that's the cruciate suture inside of the mouth. It goes, kind of half the mouth over on one side, half on the other side. I don't think you can actually see it too well, not really. So what they would find back then, and I remember a few people in my junior high class that would have braces, and then they'd often have to wear these neck braces to hold their spine in place, because the cruciate suture needs to, be pulsing up and down in your mouth like that. If the dentist would tighten this side and it was up, and then he went and tightened this side and it was down, that would put a twist going down, and then you would get scoliosis out of that.
Wow.
I think there's some kind of scoliosis if it's not really from birth, that it would take a lot, but I think there could be some traction kind of thing that you could spend some time with. It would probably take a while to actually kind of straighten the bones out, particularly if they're not in kind of a not the right form for the bone. And anything with braces could more than likely be corrected a little bit easier. But scoliosis is really kind of a tough one. But it does help people to feel less pain, no matter what kind it is. And even if you have rods up your back, sometimes that's a little uncomfortable. That will help take the pain out of the back. Even it won't help the back articulate, but it will take the pain out of the back. So
maybe that's an interesting question for Rover if you had any braces or anything like that. And then will you just show on the spine a little bit of like, for people who don't know what scoliosis
well, it's usually an
is.
S shape. It's usually an S-shaped curve. But there's lordosis, and then there's I can't remember the other one where this.
So this is the lumbar lordosis right here, where
where it
curves.
arches really bad. There's that type of a situation with the spine, and then this which will hunch over, which a lot of older people they get that hunched, and if it's not exercised, then what happens is the bones just kind of fuse together after a while if there's no articulation between them. And then this is where the spine goes way forward, and then so the rear end kind of sticks out in an uncomfortable way. But it's oftentimes too, it's just an S curve where it'll start here and it'll kind of go over to the side this way and then it'll come back over this way. So that's the different types of things I've seen over the years. If the hips are really displaced, then that's, you have to also work the hips and the sacrum to help that align. But there's, that's a difficult one. But I think that there can, where there's a will, there's a way. And I think that there's a point that you can help it out. But I don't know if it'll go into absolute full, the way it's supposed to be perfect or not. It's just hard for me to know if that's something that's able to do. I know people that I've worked with scoliosis, it hasn't been super serious. One client at one time, she had very serious scoliosis and she had to have braces just to hold her up. And there wasn't really anything I could do for her. It did relieve a little bit of discomfort, but that was about it. So that's a difficult one.
Okay, we have another question here. I remember a girl in elementary school who had a brace for scoliosis. By the end of the school year, she was able to take it off and joined one of the local soccer teams.
Yeah. So they were holding the spine in place before, if she had braces, that is. Sometimes they just did that because of crooked spines.
I think he means a back brace.
Oh, the kind of braces that I was talking, they had one under the chin, and then it was rods that kind of came there and it held their chin up, and then it was rods in the back, and then they had to wear this belt around their pelvis, around the hip bones, and then they could only just like walk really straight because it was under there. That's the kind of brace. I don't know, maybe a back brace, or it's hard to know exactly because everybody has a little bit different pattern to what they're doing. But if she did get better and she got on the soccer team, that's really great. Because sometimes it is just, bracing it for a while so the muscles build up. There's just all kinds of things that you see out there.
So for Rover, who was asking about solutions for scoliosis, what would you recommend them to do, or what kind of therapist would you recommend them to see?
I don't know. Depends on how bad it is. I think I don't know if chiropractors work with scoliosis, but that would be a rough one. That would be, a lot of pushing, but it might help. I don't know about that. You'd have to call a chiropractor and find out because I really don't know if they work on that. Or find a cranial person that knows how to traction the back from the sacrum and also traction it from the occipital base and get some traction in there. That might be able to help it stretch. Also, you may want to consider putting, some kind of a brace on just to give your body a little more help. Strengthen muscles, so the muscles that are causing this side bending or whatever's happening have help so that the muscles that are weaker on the other side can have some help and begin to straighten up a little bit. And then also watch how you're sitting. If you tend to cross one leg all the time, try to cross the other leg, so you give your body a different kind of feeling going on.
I've been trying to do that since you mentioned it. I always notice, I got to try to switch or not cross my legs at all and put my feet flat.
Yeah. So you just kind of do around, but you might want to consider some kind of a back brace. It's probably down in the low back. I don't know. I guess there's things that you can kind of wear like a shoulder, like a vest in the upper body, and that'll hold you up from the shoulders. And that's a good brace as well.
Yeah, I've seen those.
Yeah.
And then I realized that we had another.
Hopefully that'll help you, Rover, a little bit.
We had another question from Cecilia. What misalignments or body incongruencies contribute to migraine?
Oh, wow. Well, migraines are another really difficult one. There's migraines that are triggered with hormones, but I read the other day that if somebody is deficient in calcium, that is part of a migraine process. But basically, I've worked a number of migraines, and in time, they've gone pretty much away. The younger people that have migraines, their parents will bring them in, and it'll just be gone. The longest one was this one lady had migraines like several times a week, and she came for I think she came every other week for 2 years. Yeah, they were getting better, but she just wanted to keep at it till they were really gone. And then I didn't see her for like 10 years. I mean, it was like, seriously, the migraines went away, and she wasn't afflicted by them anymore. She said, I do get headaches every once in a while, but she says it's just like a shadow and then it passes. So that was all because the head bones were probably misaligned, which I could feel. And once it got more aligned and the back and everything got, in a different position, then it seemed like that alleviated the migraine. So you might want to check in and do a little research on the calcium. And also the other thing that triggers particularly migraines, and I know that Chinese medicine usually looks at this, is the liver. When the liver gets angry, then the energy will flow up to the head. So if you might want to kind of check and by that, the liver is overworking. It's it's trying to do its thing. It's got 500 functions, but if it gets backed up and kind of where toxins are coming into it, and it's hard to differentiate because it has 500 functions and 200 of them are working simultaneously. So this liver is really an important organ. But you might want to check that and just make sure that the liver and the bile is running well, because bile is like a cleanser for the system. And if the bile isn't running well, then the lymphatic system will slow down, and then that will hinder the immune system. And then of course, this is like a whole cleansing thing. If your guts are not able to absorb very much, then that toxin will just keep going around the body and refiltered and dumped back in. It'll be a cycle of continual toxicity going through the body. So that part of the liver stuff that I'm telling you could be a very big part, because we live in a pretty toxic soup right now. And so a lot of that toxicity, doesn't help the liver very much. So maybe find some juices, just take it a little easy on the liver for a while, and a couple days, and let it catch up, and see. That's just another avenue to try.
What about cranial sacral? Is there any cranial sacral therapy techniques
well,
that you think would be
cranial
helpful?
sacral is what I did on several people, and it will help, but the hormone ones are really hard. They're really hard to deal with. So if you're getting them on a hormonal basis, I would also guess that probably is a little bit overworked liver, because there's different hormones that go into the liver at that time, and it has to deal with those right away because they're toxic. And so, that will come at that same time, and that's why it might be just a good thing just to look up what's good for the liver. There's many different things just to like let the liver clean out, but you have to also know that the most important thing is a healthy gut. So there's a lot to it, but if we really want to feel good and healthy, we're going to have to just realize that we have to crawl out of this soup, because our soup, this toxic soup, also wreaks havoc a lot of times on our emotional state as well. So it's just kind of a whole body look.
Let's
And
say, ooh, excuse me, like occipital base release for migraines. Can you just kind of show? It's so cool when you show the skull, and then I'm going to zoom it in a little bit.
well, this is kind of the hard skull to show because it's.
Do you want me to grab the other skull?
I think that would be a little bit easier.
So here's the occiput. So at the base of the skull, where the spine is coming through, this one occipital bone, which you can feel if you reach to the back of your head, kind of at the nape of your neck, you'll feel those little bones of the occiput. So then one of the craniosacral techniques is kind of holding this bone and helping this align. So just this one concept of helping bring alignment where the spine is moving through the skull, and this one little cranial bone can do a lot. So I would say craniosacral therapy for migraines would be certainly something to, at least a good first avenue to try.
Yeah, it would be.
And then do you want me to grab you that other skull to show this?
Yeah, that would be okay.
Because it really is fascinating to think about how,
and actually the occipital base release, because there's a lot of muscle attachments there. It's actually to get these muscles softened.
is
so
this
that
the one you meant?
Yeah, it's to get the muscles a little more softened, because you're not really dealing with bone right there. You're wanting to go. You don't want to ever touch the middle of the spine. So your fingers will go one on this side, and you don't want to get onto the temporal bone. And then it's really hard when they don't have a body attached. And then the same thing here. And then the spine is in the middle. So you can kind of see that's how the hands go.
And then here's that sphenoid bone, another great angle of the sphenoid bone, and how important it is in making sure that the spine can function properly and the cerebrospinal fluid can flow the way that it needs to from the brain down to innervate the whole rest of the spine and the whole rest of the body.
Yeah. There's different things too in there. There's a lot more to it, but that's a good, easy kind of image to get. So then what you do here is then you want to raise the head, and the head is really hard to do this. So I tend to, because a lot of people try to hold and then they hold. And so I try to keep a hold of their head just so they feel like a little safer than just having their head up here on this pedestal. And then you take your fingers and you point it towards the eyes. So the energy is pointing towards the eyes. And then you just hold it. And as you feel, you'll start to feel softening of the bone, of the muscle, excuse me. And then the head is going to start to lay back. And as the head lays back, I always kind of catch it with my hands, but I just am holding it. I'm not pushing or doing anything like that. It's just holding it, because then they feel they let go of it much easier. And you just let the head roll back as far as it's going to go. And then you can, my hands are always on the table. And then you can just slowly pull your hands out from under their head. And then your fingers are here, and just change to the index finger and then sweep that open, and the muscles will be much softer. People really like this one when it's done right. If you're too far on the bone, it's not comfortable and you're not doing anything. You're just kind of pushing on the occiput. And if you're too far in, then you're down in the neck. So you want to, it's a very precise position that you need to find in order to execute it correctly. So that's that. That's the occipital base release. And then you can kind of check a little bit, just not much, but just kind of see what the rotation is. Some people, when they do cranial work, they really take the head every place, but I just I just get a feel for it at a small level because I can feel so much going on deeper, which comes in time. So, it's not that they're doing anything wrong, but I just move it just a little bit and I can tell if there's restriction there or not. And then the other thing you want to do here after you're done stretching it is you go back to that position, and then it's like really the two ring fingers that are right next to the spine and the occiput, is you want to let them slip in as deep as they can until you access the actual dural tube. Sometimes more than not, you'll have to access it energetically. But then when you do that, you take a slight traction toward the top of the head, and that will give a little bit of a stretch. And you can actually feel, when you get trained at it, you can actually feel where the stop points are, where there's a twisting going down the spine. So you'll be able to know where the stuck points are in the body, because it just stops stretching, and then you just wait on it. It'll eventually unwind because it'll kind of move your fingers around, and then you just keep stretching down to the sacrum. And then, of course, when you're on the sacrum, you do the same thing going up. But so there's a lot of intricate little things that happen, and that's why I think so many or several cranial people that are in the area like to come in and just say, I'm lost, help me. And I can get them back, having the confidence that, just you're doing it right. You just don't have the confidence. So just do it because you're doing okay. And you're not going to really hurt somebody. That's one thing. So.
All right, so Stewie had another question here. I've struggled with a clicking in my knee, and sometimes my knee locks ever since I got hurt during a soccer game. Is there anything I can do to help that?
Well,
so I'm bringing this knee and foot over.
Well, is there pain with the click? That would be the first thing. If there's pain, then there's something more going on, probably inside the knee. If it's not, if it's just a click, it could be the patella a little bit off. It could be this bone here, between the fibula and the tibia. It could be that clicking a little bit, or it could be something down here that's holding in a misalignment. My guess would be, without really getting my hands on you, would be that it would be somewhere in the clicking area here. It could even be on this side of the leg. It'll just click, and some of those clicks can be worked out. Then you want to also check the position of the heel strike, which is where your heel goes, because you want a good heel strike. You don't want to have the foot rolling to the side. So if you have a good heel strike, the cuboid bone, which is right over here, is going to be in alignment. I'm just going to
lift it up a little bit so it's in the screen. So here's the cuboid bone that she was mentioning, which is a really important part of making sure that the foot, the ankle, and the knee are all aligned. So this is one of the techniques that is taught in the subtle alignment course, how you would actually help bring alignment between the cuboid bone and the knee.
Yeah. And that's different ways of, putting your hands. But that's where, like if it were me doing, I would check down here for sure. And you just don't know exactly. I can't really tell you how to put your hands, because every injury has a little bit different trajectory to it. So you have to let the hands and the energy and the body show you what's happening. But I would be finding around down in the ankle area, particularly on the side where there's two bones, and just waiting until I feel that there's something that's too tight between another joint, a couple of joints, or a couple of bones. And I would definitely put my finger between that joint and see if there's any movement. I would check into this part here, the tibia and fibula, because knees, they don't really have much twisting to do. So the rest of the bones down here take a lot of trauma when they kind of are forced because of an incident. And then up here, check that area, and then just check the whole knee in a way to see if the patella you just, like just cover the joints, and there's different ways to do it. It just depends on how your hands are going to be, but you'll know it as soon as you're positioned. And then if that's not if that's not doing it, then the patella, you want to make sure that the patella is a little loose on there. There's a lot of muscle around it, but you want to feel a movement with the patella. It doesn't really attach, but it should have a little bit of movement there. And that would be the thing. If it doesn't work for that part, it might even be that there's a little misplacement of the hip or sacrum. And I would definitely, if it were you were in here seeing me, I would definitely also check your sacrum and the SI joint. But if you do get pain in the knee, if you have pain on either side of the knee, then that's not as serious as if you have it straight underneath the patella. So if there's pain under the patella, then there's more going on than meets the eye. So you want to, take note of that. So this kind of lines up pretty good. And I think that's about all I can say for it. But that would be what I would check if I were the therapist there for your clicky knee. Hopefully it's not making any kind of pain with the click.
Okay, he says it's normally on either side.
Then the muscles are probably just a little weak on those sides if there's pain. But if it's not straight behind the knee, so he would just have to take care of, letting those heal. They probably have a little inflammation still.
When was the injury, Stewie? Was it fairly recent or several years ago?
How you get this guy down?
Oh yeah, I had to bend him. I had to bend him at the knee.
Yeah. There we go.
Did this little number. Dun, 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 dun. Oh my God! Once again, though, with this little freaking thing getting in there. Okay. Skelly getting a little handsy. Getting a little handsy there, Skelly.
Really? Yeah. I mean, the skeleton has its frustration points, but I tell you, it really does help a lot to be able to get an orientation of that, because there's a lot of little bones.
So many little bones.
It's amazing.
All right. And I also just wanted to take a moment to ask you guys to please give a thumbs up on the live. You can either click the 3 little dots up in the corner of your screen, or if you just hold down anywhere on the screen for a couple seconds, you will see that thumb appear. It's not quite as hypermobile as my thumb. Man, look how hypermobile my thumb is there.
Yeah.
Yikes. Anyway.
That's okay.
But anyways, thank you so much, everyone who has already clicked the like button, and thank you for advance, any of y'all that will go and like the video. Okay, so Stewie says it was about 8 or 9 months ago. So then the body is probably just still a bit, it's still inflamed and recovering in that area.
It probably has a little inflammation, because I'm sure that he's using it. You're probably walking on it and stuff. So, but maybe in time, and maybe the click won't go away. I know that my jaw had a click, and after I had some mouth work done, the click never came back. So it could kind of go 2 ways. But I would guess my guess would be that there's somewhere along that whole alignment process from the hip down, from the sacrum down, there's some kind of little misalignment depending on how the trajectory of the injury happened. Yeah, and if you feel like the knee is a little weak, just put a brace on it when you're being active, like if you're playing soccer. It's not like you have to stop everything you're doing, but just remember that that might be a little bit of weakness, and so it makes a click when or it could be a what do you call it? A tendon that's kind of snapping over a muscle, or over a bone, just a little bump in a bone. It could be a click that way too. So there's a number of things, but getting that alignment will, 9 times out of 10, it'll change things pretty dramatically.
And then do you want to just give people a little update of how you're doing? And
oh boy,
maybe just in case anyone in the room is not familiar with what you've been through, you can just kind of give a little recap and letting people know how you're doing now.
Well, I'm I was doing pretty good for a while, and then now everything is kind of feels like it's going backwards, because the pain is in different places. Um, it's getting harder and harder for me to just kind of stay with it. I've been here cooped up in my upper floor since January because I can't get down the stairs, so I still have to have a lot of help. And that doesn't make it very fun because there's a lot of times that I'm, pretty isolated, and that is kind of wearing on me. I'm oftentimes just kind of think if it's worth continuing. I'm kind of at that stage where it's like either or. I want to stay going, but I don't know how much more I can handle. A lot of this walker stuff and all of that's going on. But I want to continue to give my information out and get as many people as possible to have some skills that will develop into their own kind of, not doing things exactly like I do things, but doing things the way that their own little platform or their own little calling is asking them to do. And I think that will be a real joy if I can get this work
Yeah.
into people's hands because,
Hey, just pause 1 second, Athena, because when you got a call, it messed up and it wouldn't let me zoom out.
oh,
So, guys, I'm just going to close YouTube and reopen it. Give us. All right. Are we better now? Is this better? She had a call come in and it that's why the phone was messed up and it was showing us that we had zoomed out, but it was I see that it was not working. It just looked like that on the phone from when it was zoomed in.
oh, dear,
Anyways,
sorry.
but hopefully we're back in action now. Sorry about that, y'all. Thank you for letting me know, Stewie.
Yeah, we're not the. Corrina's a pretty good tech compared to me. I can't figure anything out.
So just
Yeah.
as a little recap, it was about a year ago
Mm-hmm.
that you had the break in the first leg,
Mm-hmm.
right? And then about 6 months after they had put a rod in the right leg,
Mm-hmm.
she started having all this pain in the opposite hip. That was about 6 months ago. They put a rod in the left femur and also a pin in the hip. And so all of this metal that she's got now um it's really painful. It's preventing her from being able to walk, being able to do the stairs. It's been a really, really tough time. So all of you
Yeah.
being here, offering love and support, those of you who have helped contributing to the GoFundMe, like thank you so much.
Yeah.
Just watching videos here on the YouTube channel is another great way to help support Athena and all of this that kind of trying stuff that she's going through. Um, but we are so grateful for all of
Mm-hmm.
y'all being here and
Yeah, and I'm glad to share a lot of the knowledge that I have. My son keeps telling me I need to do more writing, and he thinks I should write a book. I think you said that too
I've
at
been
one
telling
time.
her for at least it was when you were in the old house. I was like, Athena, you got to write a book.
Yeah, it
So
was.
that was like maybe a year ago now.
Yeah.
But we have so many videos that we've been putting time into. There's the subtle alignment course. There's a craniosacral therapy manual that Athena wrote a few years back. That's also available on Podia that you can just download.
Yeah.
And I want to go ahead and have her do like an audio book version of the manual as well, so that we'll have like an audio version and the download that you can read. So all of those
Yeah.
things are hopefully, in the pipeline for us. We have a new video coming out. Hopefully someday this week I will have that video ready. So Stewie says, yes, ma'am, write a book. And then
You
okay, and
started
then we
it.
have another friend here. Says you can do it, Athena. Physical therapy is the hardest part of recovery. Just don't give up. You can do it. Thank
Yeah,
you for that.
I do know that, and it's for the encouragement of that because, yeah, when I have, the hospice people come over, it's like, I just don't know anymore. I'm just kind of sitting on the fence, but I really want to stay here because I think I have work to do. So
you have so much work to do. And so, yeah, it's been a hard day. And then it was really rainy and kind of blah yesterday.
Oh, yeah.
And then, so didn't that make the pain?
Yeah, the cloudy, I'll be able to detect the weather pretty soon. I'm just learning how the weather is, but yeah, whenever it's cloudy or rainy, it's it's a really different trip because all that hardware, I don't know if it gets cold or what happens, but it just hurts, and it's hurting in different places. I think that's probably a good sign because other muscles are starting to strengthen. But, 2 rods is a lot to deal with. I think my mind and legs just connected because with the walker, I'm just always leaning on it, but I have a little space over there that I walk, and then I had to stand up straighter and I couldn't lean so much. And I think that's probably new muscles that I'm feeling on both
And it
sides.
hurts when you're strengthening those muscles at first.
Well,
so
yeah.
maybe that's why you're having this like increased pain, is actually you're getting stronger. And that's why it hurts a little bit more.
Yeah, it's just the mental part, when that happens, that's so hard. And I'm at a fairly good weight. I mean, I've always been small, but mostly around 110, 112 pounds. But at my worst, I was 80, 85 or 87 pounds, right in there. And then the last time I got weighed, I was 108. So that's a good sign. And that's what I need to do. Just keep looking at the good signs and just tell this stuff to leave me alone with this other stuff. Just leave me alone. I'll just get through it. But no, I'm trying to keep really good. And I really, really want to get this out for people. And I just, really, when I look at my life, it's really still really good. I have you people out there, and I've got Corrina and my son, and there's people that do stop up and visit. So I just don't want to belabor too much on that. But some of the people I've had some difficult times with too, who wanted to help, but they kind of got in the way a little more than they should have, but yeah, that's about it. That's about all I can say because I don't want to go into it too much.
Yeah, we had another question come in. Wow, number one. I get pain on my back dimples and one hip, especially when I have walked a lot throughout the day. I also get stuck or feel stuck laying down and feel pressure when I try to get up. It brings tears to my eyes. Oh, babe, I'm so sorry.
So, is the pain just right there local, or is it running down the leg?
So back dimples, I'd be like kind of right here, just like above the pelvic crest. I'm assuming it's like that little, like the ischial. Wait, no, is it ischial tuberosity or?
It's not a tuberosity. I'm trying to think.
So like right here is where I feel mine. Get this pain right here.
So
is this what you mean?
It's right above the bone. Is it kind of right above the bone? Who was that asked that question?
Wow.
If it's on one side, that really suggests there's something tilted way out of alignment in the sacrum, probably. Or is one leg a little longer than the other one that could cause that to happen?
Which side is it, I wonder, too? Because if it's the same as your dominant side, so like you're right-handed, you step first with your right foot, is it on your dominant side or is it on your non-dominant side? Like you could be left-handed and it's on your right side, or you're right-handed and it's on your left side. It's localized in the bone.
Oh, okay.
It alternates sides depending on the day. Very interesting.
Oh, interesting. Well, that really does, because if it's on the bone, it would be somewhere here, I imagine. I don't really know about dimples myself.
Yeah, I think that she just means those little kind of, you can kind of see the little spot in the back, but it's like.
Yeah, but she said, am I mistaken? Did she say it was on the bone? That she feels the pain on the bone?
She's saying it's like in the bone.
In the bone.
So in the bone rather than in the joint? Because the joint would either be like here Or like I feel like where my low back pain is like right here.
Well, that's you know, because I've gone through all this bone stuff, it kind of makes me wonder, it's really excruciating pain
Okay, she says it is in the joint.
in the joint. Okay, well, thankfully it's in the joint. So that must be that it will come. This is a pretty big structure, so I don't know if you can. This is still right here. It's, you probably can barely see it, but there is a joint that's the whole sacrum. It comes all the way forward. So the joint could be, you know, like it, if it's in the joint, it could even be this far into the. It's just so hard to do this without having a body in front of me and with the hurting body. So it could be in between here or even up a little higher, because that's all where that goes all the way through. You know, I would keep an eye on that because I know that I went through some pretty excruciating bone pain, and they didn't think it was bone. Nobody thought of it being bone pain, and so they were just working on muscles. And then that's when my leg broke. So I don't know. I'm not trying to put any fear out there, but if you could see if the sacrum could be aligned, and if it still is there and it's still pretty painful, you might want to get an X-ray to see if the bone is got any what do you call that, osteoporosis or anything in that area of the bone, because there are some things called bone worms that eat the bone. I mean, I don't know how common that is, but that's what somebody was saying. Wow. That was happening to my bones.
But then, so I would say craniosacral therapy would at least be a good place to start, because then the sacral pull, essentially the person places the hand on the sacrum, and then you just gently offer this gentle traction downward, but it can help create more space through all of the spine, really,
Yeah,
but especially in
this is where the area. Yeah, so much of things that go wrong is a misaligned sacrum. At least that's what I've noticed over the years. A lot of times, a lot of different changes happen when that sacrum is aligned. It just gets out a little bit, you know, just go just to the side a little bit, or a little bit of a torque or something, and that just screams all over the place. Because there's a lot of nerves here too. So I don't know. I hope that helped a little bit, because yeah, some of that stuff, I don't know. And when people come in with these odd kind of sensations all over the body, it takes me a while to really figure out what's going on as well. Because, you know, I got to check here and there and all that, and they've got to tell me the level of discomfort. And so sometimes it takes a little while, but I always in every session that I do, like that, is I would do the 10-step protocol and concentrate on the sacral alignment. That would be a good thing. So that's what you might maybe want to ask a therapist. And if you're looking for a therapist in your area, just go to Upledger, upledger.com, and then look for find a therapist. And then they do it by zip code. So if you know your surrounding zip codes, you can find that. And then just give them a call and ask them if they work, you know, to align the sacrum, and, you know, get a little information for them and ask them questions to make sure that they know what's going on. Because you want to get somebody that would be able to know how to work the bone. Even though it moves itself, there's still little tricks to the whole thing, because sometimes it gets stuck and you have to nudge a little bit and that kind of thing. So I hope that helped a little bit. Those are hard questions for me.
So we have let's see, sciatic nerve pain.
Yeah,
as a question.
Sciatic is one of the easier ones, actually, and that happens because the nerve, the sciatic nerve, is coming out and it's pinching, and a lot of the therapies, like, you know, like the
will you show again where I just kind of zoomed in there?
Oh, right in this area. This is the bone the sacrum. That's the bone that's tilted one way or the other. That's usually what I find. It's tilted or twisted or something. And then it pinches the sciatic nerve. I don't even think they distinguish. It's a bigger nerve, and that runs through the hip and down into it just runs down the leg. Sometimes it doesn't go all the way down. Sometimes when it goes all the way down to the foot, then it's pretty bad. But it starts out being just in the upper leg. So with that, you would want to find a therapist that could do a 10-step and balance the fulcrum, as well as getting the sacrum also aligned. And that I see a lot of things for. I mean, I see people, they may leave here and they still have a little bit of pain, but in a couple of days they feel a lot less pain. And oftentimes they don't even come back because it's corrected itself. Because once I leave my hands, have my hands off of people, that tissue reorganization is going to continue for 12 to 48 hours after the session is done. So you want to be careful during that 12 to 48 hours. You can do whatever you want to, but don't push yourself. But yeah, I've seen a lot of success with sciatica, with just realigning. Because, massage people, they just go in there and they push on the nerve. Well, in my mind, it's like, why are you pushing on a nerve that's probably inflamed and maybe squished? And why are you making more trauma on the bone? So, people have to start thinking that way. Like, what am I actually really doing when I'm using my hands? Am I helping this thing to be unlocked, or am I just causing more stress on the area? So that's what you would want to ask a therapist. You just start thinking, and don't be afraid to ask, because that's the only way you're going to find somebody that you really resonate with. So that's what I would say. Yeah, it's not easy when we're all over the place, but
Yeah.
maybe at some point we'll have magic flying carpets or something we can get from place to place really fast.
Yeah. And then kind of echoing what she had mentioned earlier about kind of noticing your posture, noticing if you're like, for instance, you always cross your legs. Like I always cross mine right over left. And I started realizing, oh, I probably, every time I do that, it gets starting to get really uncomfortable. So now I try to switch, cross the left over right instead, or just sitting flat and really making myself really try to become aware of the way I'm sitting, and that I'm not leaning, and that I'm trying to be balanced. So what your little sitting bones that you balance on down here.
Oh, that's the pubic bone.
The
That's
pubic bone. So the sitting bones. I turned him. I forgot I turned him around.
These are the sit bones.
His
here.
Little sitting bones. So when you're sitting down, you can start kind of noticing if you're feeling like you're balanced between your two sitting bones. Yeah. And what I've noticed is that when I drive, I lean to one side and I rest my arm on the armrest. And so when I'm driving, I'm always crooked. So now I just try to be really aware of sitting up straight, sitting so I'm balanced on either side. And if you can start to counteract some of those common movements and postures or things that you're doing, then that can also start to bring a little bit more balance. So if you're always walking upstairs and you always walk with your right foot first, your right dominant, try switching. And this is something I've been trying to kind of do.
It
and
really
it's like,
wreaks havoc in the brain.
It's kind of crazy, but I'm like, okay, I'm going to step first with my left foot. I'm going to try to bring more balance because I know that I'm very right dominant, right side dominant. And now I'm just starting to become more and more aware of how that's, creating different things and different discomforts in my own body.
And if you really want to give yourself a test on that one, take 1 week of your life, and if you're right-handed, do everything with the left hand and vice versa. And that includes like brushing your teeth.
I've been trying to brush my teeth with the left hand. Why is it so difficult?
It's because the brain is conditioned in a certain way.
Can't figure it out.
I used to wear a watch on my left hand, and so when I did that exercise, it was really tormenting for a week. It really was. It was hard to eat with the other hand. But I put the watch on my right hand. I couldn't even figure out how to look at the watch to tell time. I mean, it was like, where's my watch?
Can y'all believe this thing up here is a clock?
Okay, you see it?
I'm like, Athena, how do you read this clock with no numbers, with no anything on it? But
You guess.
anyways, that's incredible.
Yeah, people don't know it's a clock, so.
People don't know it's a clock. Okay, so we did have another question here. Thank you
Okay,
all so
yeah.
much for your questions. Absent minded, I love it. Hilarious. Absent minded, would craniosacral therapy still work if you're microdosing on the magic mushroom type of situation during the session, or would that change the rhythm?
I don't know about changing the rhythm because the cranial rhythm is just there all the time because it's pumping the cerebrospinal fluid. When you're on a subject, like this is where people don't understand. If I'm doing emotional work with somebody and I ask a certain question, and I always tell them, take your time to answer because you got to dig deep. But if the cranial rhythm just stops, completely stops, that usually suggests that I'm over target and they're not comfortable about wanting to say anything about that. So if they start to say a story that's not even really related or making something up, the rhythm will come back on. And then I know that they're not being honest with the, yeah. So I'll go with that. And, once the rhythm will come back on too, if they're, it takes a little bit while because it'll stay off, but then if they're telling the truth and they're trying to work through it, it'll come back on, but then as things get more painful to look at, it'll stop again.
Mm.
So you can really tell, if people are doing their work or not. And the ones that do their work, they change a lot in that emotional stuff. They really do. A lot of them don't like to do that because they don't like to go there. It's not fun to go there because you really have to peel yourself back. But that's how we heal a lot of our inner self. And there's, talk therapy really doesn't work. It's got to be the feeling, the emotion, find that emotion that's really driving that. And it's almost always, it has other facades in front of it. It has buddies. I call them friends and buddies and, that. But it, I would say 99.9% of the time when we dig deep enough, it's a fear. People all of us have a fear, even though it might not seem like it.
Mm-hmm.
There's still a lot of fear that we're um, dealing with. And I don't know, I'm at a point actually now that I can kind of pick that up when people are not wanting to really just in normal conversation, when they don't want to really be totally, upfront about what's really happening, or they want to stay in denial about something they did, but they want to blame somebody else. I can pick that energy up now. That'll be another thing that happens if you get into this and you practice a lot and you make a, pretty much of a centerpiece of your life, part of the centerpiece of your life. You'll get to the point where you can read energy pretty easy off people. And I've been told that over the years that I'm at a point now where my intuitive senses are really, really acute. So there's things that I get from people, and it's like I don't even know where it comes from. And a lot of times I've learned just to not say anything because it makes them too irritated. And then I don't have any friends left.
So then, similarly, there's a second question. What if someone is on pain pills during a session? Would that affect the body? Would the pills mess up the session for the therapist? Is the
No,
question.
no, and the mushroom part or whatever microdosing, that's not going to really change a lot. That may even work with some of that. I don't know what it is exactly, but that may even work with it a little bit. But now, pain meds, if they're pharmaceutical pain meds, they do make a difference. And the way that they make a difference is that they sedate the body so much that the rhythm becomes real small and real light. There's not a lot of volume behind the rhythm. And it kind of interferes that way. But I will also say that when people are, when they're in a lot of pain, you got to do what you got to do to try to get out of pain. I use this stuff that some of you might know. I don't know if I dare say it on this channel, but it's from a tree bark, and it's really effective because it does work in the same place as the pharmaceutical drugs work in the brain. It's in the same area of the brain, but it works different with the receptors. So the receptors are different. So that kind of thing, when it's more natural, doesn't tend to interfere. Same with those micro dosing of whatever is happening. It's not, if it's a natural thing, then it really doesn't. We have receptors for all kinds of things, you know. We even have receptors for tobacco, and tobacco is actually not bad. The only part that's bad about tobacco is what they put in it, because we actually do
all
have
the other chemicals.
yeah. So it's like, you know, and they did notice that during the mask era, that people that did smoke, they had less issue with getting sick. So something there was doing something that I don't really know, and I haven't gone deep enough to study. That's just very superficial. But we do have a lot of receptors for a lot of things that are natural, but we don't have those receptors for the things that aren't. So that would interfere only because it would take your system a little bit too sedated, but the body will still do the work that the body needs to do. It's just that it may take a little longer for you to realize it. And, you know, because you really have to, when you're in pain, you'd have to take that pain away, because the body will only focus on the pain instead of on healing. And that's what I have to keep telling myself too, because it's like, oh crap, you know. But when I think about it in that way, it's like, yes, do take the natural stuff I'm taking, which is very effective. Dosage isn't really a problem with that. You know, just find where it helps, and then you're okay. Some people need more, some people need less. You have to find your own dosage, because we're all different. And realize that just taking that edge off the pain will help us to heal, because then the body can concentrate on healing and not so much on the pain that's happening with all those whatever pain. I don't even know if I want to even study what pain is, because it might make me have more. I don't know.
So
I hope that helps.
yeah, so
both of you.
craniosacral therapy, you think it would still be effective even if somebody was taking one of those things?
Yeah, particularly the natural. The unnatural, like I say, it'll just sedate the body a little bit more, and things will be moving slower. So it might not happen as quickly, but you will still, if you have just doing cranial work, the body will work, even if the therapist isn't even really acute with where her hands go. There will be changes in your body. It's just that there's a varying degree. And I don't know if sedation, you know, you kind of go into the sleep mode. I don't know how that would interfere or help, all of that, but it's a little bit more of an induced thing. But the body will still respond to the cranial work, no matter what. It'll still respond. So that's just the way it is. That's what John used to say. He said, just do the work. The work works. Just do the work and get better each time you put your hands on someone's head. So yeah, I wouldn't be too overly concerned with that. And you might want to take the pain meds if you were going to go to a session. You might want to take the pain meds earlier, so that they're not quite as strong when you get there. And then the session, and then you could take it immediately afterwards, you know, if you want to do something like that. Or just if you're going to multiple sessions, you know, once a week or once every 2 weeks, you can kind of play with that. Like last time I did it right before, and so let me see what happens if I can wait a little longer. You know, so just kind of play with that and get to know your body. That's really the main thing. You've got to know your body, because what I'm doing for me is different than what Corrina would do for her in the same situation, because our bodies are just different. And I don't want you to be in this situation either. So I'm not putting any hex on you or anything like that. But it's important. We do have to know our body, and that's another part of what I want to do, you know, for upcoming days and hopefully years, is really get the understanding of how to the power that we have within, you know, our intuitive parts, and telepathically. I'm reading about that. So if people are interested in it, I'll share some of this on these live chats. And then maybe I will need to write a book.
We also, if any of you guys are interested, there is an email newsletter that Athena puts out periodically, and we've got that available. If you look at the description in this video, I left that link. Basically, it's when you go to her Podia site. So if you want to sign up for her email newsletter, that would be a great kind of preliminary to the book, so to speak.
Yeah.
And then anytime we post new YouTube videos or new coursework, we put that in the newsletter as well. So that's a great way to just kind of stay aware of any of the new offerings that we are putting out there.
Yeah, the course is like an introduction to all the different things that in the subtle world. Not it doesn't go so much into energy, but it does talk a little bit about it when it talks about what different parts of the body have meaning for what they're afflicting, what's being afflicted.
Mm-hmm.
That's another kind of a whole nother, you know, section by itself. But we also are getting where if people don't want to take the whole course, then there's small parts like just learning the bones, and those videos are soon to go up. We got the skeleton on the table, and then we have another person, so you can actually see it on the bones, and so you'll be very clear what's happening when you see it on a leg with all this other stuff around the bones. So that's just another thing if you're interested. You can, and if you have any questions, of course, you can always email me at the athenajezik@hush.com. And I've been talking with several people that, oh, one lady in particular, she got the course, and then she wanted to just go on with it. And she, I don't know, my gosh, she's helping her family out, and she's talking about all this energy she feels going into the body and out of her hands. And I said, you gotta get out there to the world, and because she's just got it, you know. And she just learned from everything. And when every time she had a question, she would just send me a question, and I'd answer it, and she'd go back and know that she's either doing something right or she needs to adjust something a little bit. And yeah, so I'm there for you if you really want this stuff. I'm there for you because you know, it's just you never know. So,
Mm-hmm.
but I do want people to be better than me by far. I want them to just develop into magnificent um, therapists. And even if these med beds that we've been hearing about forever, even if they come out, the real med beds, there's a lot of fakes out there, but you know, we got to get out of the fix it mindset. We've got to realize that all that stuff, that most of the stuff the med beds can do, we could probably do ourselves. And there's nothing wrong with having a little help. Like for me, I'd like to get the rods out of my body, so I would like to be in a med bed so that that whole part can change. However, um, there's most of this stuff that we're doing when things aren't so critical. We have that power within, and it's really connected to the mind and how we're thinking and the gratitude that we live in. And we'll swing up and down, you know, we'll just swing up and down. But I'll tell you, really, more than anything, if you know your body and you understand how powerful humanity is, I mean, we have been so dumbed down that it's time to raise our awareness and our knowledge and our wisdom and all of that stuff, because that's when we're going to find true peace, because we'll all have a sense of being free and independent and healthy and helping each other. And it's it's really about that, in my opinion, that, you know, it's not about running around trying to find happiness in the world, even though that's a big part of it. But you're not going to really find that happiness until you really know who you are and that you are helping out people in some way, shape, or form. And that's a lot of gratitude.
Mm.
So, you know, that's, I think the new world is going to be like that. And those that choose to kind of stay behind in that because it, for whatever reason, are somewhat holding us back. But I think there's going to be a point where they'll just have to, you know, be left behind or something, because it's getting to be so much, so many more people are pushing forward. You know, just even thinking of how it was for me in the 90s, that people wouldn't even, I mean, they were scared to death of a little tincture of herbs, and it was like dandelion, and it's like, oh no, I'm scared to take that. And it's like, it's dandelion, you can buy it in the grocery store. Oh, I'm not taking that, you know. And it's like, because it was concentrated dandelion in a tincture. to now people are actually seeking after doing things a little bit more naturally because they're realizing that the help that they thought they would get from other places is not necessarily helping them. And sometimes they feel like they're getting worse, but that kind of thing. So, yeah,
Mm.
I can just go on and on about that, but I do really desire you all to begin to just tell yourselves you're really powerful people. We just have to learn it. And even if we don't believe it at the time, just have faith that you are, because we really are powerful.
Mm-hmm.
Yeah, until we fall in a hole, then we have to work ourselves back out of the hole, which it's not that hard. It gets easier and easier, really. So anyway, enough of that
Yeah.
chatter.
So we have another question, absent-minded. Could you explain your energy work? How do you use your energy to help people? I'd like to know how to harness mine.
That's a good question. How I use it is I it's like you don't want to really think about it in an ego sense. You want to think about it in like this more humility way that you have that energy and you can move it. So if you want to access yours, like what I do with most people that come in here is I'll start at the feet and I'll just like hold them for a few minutes and then I'll just kind of, okay, energy, move out of my hands. I want to push energy into this body really hard. I want to push a lot of energy in and I'll just wait. And pretty soon you start feeling something, you almost think like it's just silly. I mean, it's because it's different. And then I can feel it pushing up and I feel it going up their legs and all that. And oftentimes, if people are a little bit more accustomed to my work, they'll feel it go up their back and, all that. And then I pull it out. Then I'll say, okay, the energy enough in there, let's pull it out. So then I'll feel it like it just pulls back out. And then then I'll say, let's go to neutral because I want to work with people with neutral. So I get an idea of how much energy they can handle, what happens when it gets a little more deficient, and then being in neutral, because that's a good place to work on them, because then there's not this energy transfer. So it's really about getting inside, and you have to feel, at least the way it works for me is I have to feel it like coming from my heart into my hands. So it's like a connection that from higher source down into the heart, and then you can feel the energy going. And I don't really understand a lot of that yet. I just know the things I'm doing, it's helping. One of my favorite body workers that lives, she doesn't live here, but I talk to her a lot. She says that I really have a strong, strong energy that can come out of my hands. She said she's never seen another healer that has that much. And I'm thinking, I don't know what I did. I remember the first time they had us do this in class, nobody wanted to be first. And so I ended up being first. And so it was like, I don't know what I'm doing. So don't worry about that, but just start to think of it in energetic terms. And you can also test yourself, like just by putting your hands together. Well, not really together, but, just kind of holding it and then just visualizing, the energy from one to the other, and then kind of, if you start to move it like this really slow, you have to be kind of patient with it. Pretty soon it'll feel like there's like a Nerf ball or something in the middle of your hands that's just going in and out. And then you can feel it in your fingers. And as you practice kind of what it feels like, then you can go and you can, you want to go slowly into a body. And so you want to go slow because otherwise the energy is a little bit too strong. It could be. So you want to go slowly into it so it feels like it's just there. And then you can leave an imprint there too, because then when you're coming out of it, you go really slow out of it and you leave an imprint of energy there. And then if you feel stuff coming up that's a little like not right, like you're pulling something out of that energy field, then I usually just grab my hand and kind of twist it and then just toss it. Um, I like to have my window open just a little bit, unless it's too cold, or I even do it in the heat, but this is a cool room. So yeah, you can just practice like that. And then also begin to, it seems like our reaction is always like when somebody says something that we don't really agree with or we haven't heard it before, we tend to get a kind of a trigger inside of us. So kind of quell that trigger back and sit back and just listen to everything that's being said without an urge to speak, because we don't really know what they're trying to say. And afterwards, you'll be, while you're doing that process, you'll be able to feel the energy and you'll be able to start to discern with a lot more accuracy what's happening. So that's really what I do. And other people, you just kind of, you have to, the energy is there. Just know that it's there and it's coming out. The right hand typically is the hand that is pushing things out, and the left hand is pulling things in. So one lady who was in pain, she had cancer in her lung, and it was way up here, and she was in a lot of pain. And I just put my right hand, that was going to push things in, and I had my left hand toward the window, and I don't really know why I did it. It was an intuitive thing. It was like something from somewhere else, but anything that seems weird I'll do, because it's usually what I'm supposed to do. And I could feel energy just coming into this hand really strong. I mean, pretty soon my hand started to tingle, and then I could feel it going through the heart and down, because I was pulling energy from somewhere else, but I did feel it through my heart. And then I could feel it coming out of this hand, and I was touching her body, so I could actually feel it going into her body. And I held it there for a while, and then it had this really nasty feel to it. So when I was done, I just kind of know when you're done. I took my hands and I put them in a ball, and I just ripped up this pain that was in her thing, and I just threw it. And she said, "Oh my God," she goes, "I don't hurt there anymore." And it was like, I mean, I didn't really know what I was doing. I was just following following. And so that's how you would want to start doing it. Just start by just feeling that energy, and then, just know that it's there, and be careful with it, because it's powerful. And you want to stay a little bit more in your, like, in humility, in a like a grateful place, and not like show it off too much to people or get into the ego part of that energy, because that's when it can pervert and become not a good thing. But so we have to always be careful of how we're standing if we're doing it, because we want to develop it, and then we can touch people and ask for a certain energy to go in and help whatever it is they need, and then imagine it happening. So much is in the mind, and when you start to imagine it happening, it's probably happening. But it's good to stay in a little bit more of a space of, not letting the ego out, or not being afraid of somebody correcting something, or, just kind of in the state of now. I'm in now, and usually they'll give you validation somehow, or you can scan the body if you're, with somebody, and you'll feel like, oh, there's something here that's going on, because it just feels rugged or something like that. So I'll just put my hand on it, and they'll say, well, how did you know to go there? And it's like I said, I don't know, I just did, because I don't want to
Because she trusts her intuition. And she developed this kind of sense of intuition that, because I've had that experience. So y'all know I've been the massage model for Athena many, many times over the years. And I've definitely had that experience you're describing, where you'll be working on me doing something, and it's like you go right to the area of my low back that feels sore, or like I had a knee that was clicking, and she did the subtle alignment with aligning the cuboid bone in the foot and the knee, and like my knee has never clicked again since we filmed just filming that video for the subtle alignment course. But so I can definitely say that weird feeling of like, how did she know to put her hand there? How did she know that's where my back was hurting? Like, but that's that intuitive nature that, I don't know if there is a way that you necessarily develop it, but you over the years learn to listen.
You can develop it, but it is really important, though, to stay in kind of a state of where your ego's not getting involved, because as soon as that gets involved, then it's it's a different process. It's like it's going more through the brain. Now there's, there's the third eye and the crown chakra and all that helps with a lot of that as well. But it's different because it aligns itself with the heart. And I always feel the energy coming up through my arms from the heart. And that's when I know that I'm in the right position for that. And
Wow.
I very rarely will even tell people that I'm going to do some energy work if I'm on a bone or a muscle or something. And I'll just go really light and just put energy through my fingertips. And I can feel that that's energizing to move. And, then I can just do a little muscle work, but not very much. So it makes the job kind of easier. It's definitely easier than massage therapy because, you're just working with subtle things. So I
Mm.
would just encourage you to try that, and not worry if you're not feeling it right away, because a lot of it is getting the head out of the way and getting into the state of just being like a student again in something that you're learning. And this might sound really crazy to some of you, but there will be, I don't know how people interpret this in their own way, but there will be help out there helping you if you have the right attitude about it and you're doing it for the right reasons and you just want to develop that. I think that I'm not sure about this. If you're a karate person or a martial arts person, the energy that they develop is, I think, similar, but it's kind of, they use it differently. But it seems to me like that is really an energetic
Mm.
kind of
Mhm.
practice. But I can't say that for sure because I don't know. My grandson's, up there, black belt. He's wanting to get his next, but it takes 5 years or something to get it. So, and he's 21. So, you know, I watch him do that, and it's just like, you know, it just like he took these two big guys down. It was like keto, I think. He just took them down, and I said, "Was that staged?" Did And he goes, "No, he took them right down." And so there's got
Wow.
to be something to it, but I sure don't know. And I'm at this point, I'm not going to veer over in that direction. So if you're a martial arts person and you want to share some of that, that would be great. Um, yeah.
And then someone asked, how do you clear energy from yourself?
Oh, I just take I just kind of move it up and out, you know. I move it up and out. I can't do any sage here because I have these little fire alarm things, and if it goes off, I have to take a baseball bat and try to hit it because there's no way I can get up and stop it. So I don't want to burn anything. Sage is good if you can do it outside, or I'll play like a 528 fork, which will, it's the last one by the big bowl. That's 528. It's not, it's on the
Oh,
first
I see
row.
it.
Yeah. Is this tone?
Do you need a
I need a, yeah, because this is a real nice tone. This is the tone 538. It's solfeggio. And I'm not really a sound therapist person, but I listen to a lot of people, and man, these people that know sound, they are so fascinating. And so the 538 sounds like, I don't know if that's hearable, but I will take this a lot. And a lot of times I'll clean my room with this tone. I'll walk around the room and I'll do that. And then before I start a session, I ask for sing it one more time. I'll ask for a hedge of protection to be around this room, over the person, over me, around this room, around the house, and around the total perimeter of the property. So, and I just make that, it either comes to me as a gold hedge, a silver hedge, or a crystal hedge. So I do that before the sessions, and then I just sweep off anything that might be left. Because when we get around negative energy, we actually do, um, well, people that have negative energy can leave stuff behind. There's like little neons, they can leave a lot of stuff behind, and that'll pull us in different directions. So just however you feel like, just clearing, just clean energy. But I like to do that a lot. And then I will also use, one girl came in, she was real sensitive to all that. She came in and she said, "Your room looks really different." And I said, "Well, it hasn't really changed." She goes, "Well, what's different about it?" And I said, "Well, just before you got here, I went around with my 528 fork. She goes, it's got to be energetic, because she says it's really different in here. So, you know, so that sort of stuff helps. And you don't have to be an expert in it. Just, this is just a really important tone, because this is the tone, like from what I read and a little bit of what I'm reading. And again, sound people, you tell me if I'm, you know, wrong, because I'm not concerned about being corrected. But this is the tone that if we didn't have this particular tone out there, we would be unable to have like green trees and green grass. And it does kind of relate into the heart area, the green. And it's just a real peaceful thing. I laid on the table lots of times and just played this, and it does take you to a pretty nice place. So that's another way you can clear energy. I'm not so concerned about it anymore, because I feel like I do have a lot of protection around me. But I do always do the hedge of protection just to get an extra layer. And then at the end, I'll just like, and then I'll wash my hands, and then I'll just kind of push everything away. Like, you know, I don't feel too much stuck stuff. But if my, you know, if my mood gets to be super crabby, then I know I've got something hanging on to me that I don't want. So we must be getting close. Yeah, I appreciate these questions. I just hope I don't get too long-winded, and I hope I'm answering them.
No, everyone, Athena, everyone has commented. Thank you so much for answering. This is so helpful. Everyone has left such sweet comments today.
Well, I think these people are in a whole different class of people if they like this weird talk.
And then I thought I would switch microphone, and we can do a little singing bowl section to close. Does that sound nice?
Yeah, if there's no more questions.
And then, hold on, you guys, I'm gonna just, all I have to do is figure this out. How do I mute it? Oh, mute microphone. Okay, hold on one second, babes. We're gonna switch microphones here.
Okay, we're back.
Yes.
Did this sound okay when what's happening here? Does that sound okay through the mic? This is the 528. These other bowls here augment because they're hand hammered and they're old. is a higher pitched one. This one is like the connection above. It's 963 hertz. When I play these for my clients at the end of the session, they all just really drift away. You hear the difference. More? Oh, okay. There we go.
I feel a lot of stress is leaving, Sweetie says. So there's no other questions? Do you want to?
Do they have a few more questions? Yeah, that's fine. Yeah. Well, yeah, these bowls really are relaxing. Okay. I'm glad some of you felt a little bit of relaxation with the bowls. If you do want to get a bowl, try to get the hand hammered ones. They're a little bit more expensive, but the new ones, they don't augment. They just don't quite sound the same as the old hammered ones. Or if you want to get the, you can look online and you want to get a solfeggio, different hertz. You can check for what they are. There's a lot more to what they do than just the brief stuff that they show. But you want to look for solfeggio. There's 9 forks of solfeggio, which supposedly are the 9 tones that we have. That's the tones that we have, and there's 440 hertz is what we've been told that we have to tune our instruments to. But if people are now starting to tune them to 432, if I might be, it is, yeah, 432. And then 528 is like, that's the really good healing. I mean, that's, people like that. I've picked up a couple extra forks for a couple of my clients that have done extraordinary help for me. And so they love it. They ding it all the time. So I would just say that about the bowls. I don't have much experience with crystal bowls. I like the metal bowls, but anything that sounds good to you, I would say, you know, we're all different, and there's not any right and wrong. There's just stuff works and stuff doesn't work. So, yeah. So with that, thank you so much. I hope I was able to answer some questions and bring some new insights. so that you can get more inner standing and just kind of see the world in a different way and maybe refocus a lot of the stuff that's happening out there in this movie land. Just kind of let it all go, because humanity is moving towards a whole new, it's like it's really going to be a new age or a new time. We just can't go on this path anymore. So it's the people that are making it change. So keep your hopes up and keep the faith and keep growing and learning. And I'm just really grateful to be a part of this process for all of you. Thank you so much, and see you next time.